Hello everyone, welcome at SudhirEyeCoach, a channel for budding ophthalmologists. How to handle black hard nucleus with phacoemulsification? Because for the safe phacoemulsification, we need good exposure of nucleus, so always try to make a larger access. So try to stain the capsule with Tapon blue because we need easy capsular access. Often with the harder nucleus, the glow is not proper. So stain the pupil and then start the capsular access and try to make as much as large access you can make. Always pre-operatively assess the patient's comfort level, patient's cooperation level. Patient is not cooperative, patient is quite old, and if the exposure of the globe is not proper, sunken eyes, so always try to give anesthesia to make the surgery comfortable for the patients and for yourself. So here I created two side port incisions, one for the capsular access and one for the second instrument and for holding the globe, for the stabilizing the globe, and created the main corneal incision. And I started capsular access and deliberately I created a large capsular access. Often the black nucleus is associated with very less epinuclear plate. So try to do very gentle hydro procedures, and it's a combination of both type of hydro procedures, dissections and delineation. Selection of viscoelastics is again very important. Always keep all variety of viscoelastics available on table because here we need to protect the endothelium, and we have to maintain the antechamber well with the viscoelastics. Nucleus fragmentation becomes quite easy if you create a trench, and if you're a beginner, try to do divide and conquer technique. Create two trench and then start the phaco chopping technique and try to divide it with holding the piece, or you can divide the nucleus with two set of choppers. Normally I create one trench and then divide the nucleus in two halves, and then I'll do stop and chop technique and divide nucleus in smaller fragments, and always try to keep the fragments in the bag because I don't want to nucleus fragment come out and rotate in the antechamber so that it can give damage to the endothelium. So now after dividing the nucleus in smaller pieces one by one, try to hold the nucleus and keep it in the center and try to do chopping and phacofragmentation at the level of iris plane. To protect the corneal endothelium, you can fill the antechamber with the viscoelastics again and again, and here we basically prefer dispersive viscoelastics because it coats the endothelium and it protects the cornea. Selection of chopper is again the personal choice. You can use sharp instruments or you can use a simple blunt Sinsky. I personally prefer to use small Sinsky hooks because I think in my perception, because the phaco tip is active sharp tip, so there is no need to put another sharp instrument in the antechamber. One problem often occurs, and that is the clogging of tubing. So uh, in between, if it happens, then you have to flush the tubings to make it patent again. Here I completed phaco fragmentation, and now thin epinuclear plate is there, which I aspirated very easily with the IA tip. I always prefer to flush the posterior capsule and with the BSS with the blunt cannula, and it basically removes the fibers and cells present on the posterior capsule and from the equator. Now eye is ready for implantation, and I implanted hydrophobic implant in the bag. So tip for the safe phacoemulsification in harder nucleus is always do the operative examination and assess the patient's comfort and patient's cooperation level. And if the patient is not comfortable, then always try to give anesthesia and do surgery under local anesthesia. Then divide the nucleus in two halves by using French technique or divide and conquer technique. And for phaco for to protect the cornea endothelium, always try to use dispersive viscoelastics in a copious amount to coat the endothelium. Thank you very much.